Before I take questions, I once again want to thank this fine institution and these fine professionals and the kids for being way quieter than I might be at that age at this time of the day. But thank you for having us. I'll now take any questions.
Governor, during the campaign, you said that one of your first things you would do as governor would present a supplemental budget that would completely reinstate the 2005 Medicaid cuts. This isn't a complete reinstatement. Why did you decide to go this route instead of reinstating all the cuts?
Well, we did present a supplemental budget to call for the beginning of restoration of cuts. In my State of the State, I also called for additional $62,000 to be covered. We were disappointed last week when the legislature refused to make an important first step in that supplemental by expanding coverage for kids. We think this provides us the important step forward that we need to make to begin the process and progress in health care. This is a very, very solid opportunity. $52 million from the hospitals, $93 million from the federal government, $145 million into the healthcare system without a penny being paid by Missouri taxpayers, we think is a solid first step to move this state forward. I think it's the right step, and I am hopeful and optimistic that the legislature will join me.
Are you positioning this $52 million as not new state money because it's already been distributed to the hospital associations? Because during the campaign you did say that uncompensated care payments were state money.
I'm not positioning anything here. What I'm saying is that we have sat down with the hospital association, as I did in the campaign, where part of the coverage of the plans that I laid forward was the potential to use additional resources here. I think the fact that over the last 6 or 8 weeks we've had thoughtful, deep, and appropriate discussions about how to maximize this opportunity in a difficult environment. And quite frankly, it's very difficult for me to imagine what the counter discussion is to this. Putting $145 million into the healthcare system, expanding coverage from 20% to 50% FPL for families, many of which are working out there and don't have coverage, helping clinics like this and hospitals help meet their costs by actually getting reimbursements for the things that they're already providing. You saw Jim Ross talk about the $40 million figure of uncompensated care. We're trying to dig into that so that we can make institutions like this and hospitals and other things around the state more efficient, as well as getting that downward pressure on premiums.
Why would the hospitals want to jump into this, and can they afford to throw that money in?
Well, they clearly can, and I think that the reason why is relatively apparent and pretty simplistic. Some may try to make it otherwise. It's simplistic in this regard. They're the ones that are on the front line. When folks don't have health care coverage and they need a procedure, or they're sick, or they're overly sick because they haven't accessed any sort of preventative care, the place they show up is at one of the emergency rooms of the 152 hospitals in the state of Missouri. And that is the most expensive place to meet health care. And so these hospitals, when folks are not covered, are having huge dollar numbers that they have to lay out in uncompensated care. You saw once again Jim Ross talk about this and this, just the institutions around here, that number being $40 million. So coming up statewide with $52 million to help us augment and get the federal dollars, I think they think it's a smart play for the state. It's a compassionate play, but it's also a smart bottom line play for them to try to make sure that there is adequate reimbursement for services that they're already having to provide.
Jim,
is this going to be a permanent situation, or is this money that could go away sometime on the road?
Well, I mean, the provider tax, the FRA process started during Governor Ashcroft. It's been a process that has been in law and in place since that time. We're not asking for changes in the law to do that, so this process will clearly continue. This isn't something that we'll give and take away. This is a continuation of the process. It is a system that's up and operating, has been operating since the 1980s. Their willingness to come forward a little bit more at this time is a good timing for that. They have in the past come forward at various times with more. This one we think is very important at this time, especially with the economy hurting the way it is.
What